In this podcast episode, neuroscientist Dr. Nolan Williams discusses the connection between brain function and mental health, particularly focusing on depression and anxiety. He explains that our perception of control plays a significant role in our mental well-being and that depression can be seen as a loss of control. Dr. Williams describes a study in which individuals who experienced social defeat stress had a specific brain region, the left or cilateral prefrontal cortex, go offline. This region is responsible for control and perceptions of control. Accumulating experiences of loss of control can train the brain to keep this region offline, leading to depression. Dr. Williams explains that transcranial magnetic stimulation is a technique used to stimulate the brain and restore control in individuals with depression. By targeting specific brain regions, TMS can reverse the offline state of the prefrontal cortex and restore control. He shares examples of patients who have undergone TMS treatment and experienced a significant improvement in their ability to control their emotions and behaviors. The conversation then shifts to the topic of AI and its potential role in understanding and treating mental health conditions. Dr. Williams suggests that AI could be used to analyze patterns of brain activity and develop personalized treatment approaches. By tracking brainwave patterns and training individuals to control their brain activity, it may be possible to achieve a desired emotional state, such as joy or calmness. The discussion also touches on the relationship between the brain, gut, and emotions. Dr. Williams explains that emotions are not solely generated by the brain but are influenced by the body, particularly the gut. He suggests that factors such as diet and mitochondrial function may play a role in mental health and should be further explored. Regarding the impact of COVID-19 on mental health, Dr. Williams acknowledges that the pandemic has exacerbated feelings of isolation and loss of control, leading to increased rates of depression. He suggests that therapy, particularly cognitive behavioral therapy, can be beneficial for individuals experiencing these challenges. Additionally, he emphasizes the importance of early intervention and preventative measures in mental health, similar to how other medical conditions are addressed. Dr. Williams goes on to discuss the link between depression and heart attacks, noting that negative emotions and depression can impact brain networks connected to the heart. This connection between the brain and the heart is still not fully understood, but conditions like broken heart syndrome demonstrate the influence of emotional experiences on the heart. Dr. Williams then introduces the concept of Psychiatry 3.0, which takes a circuit-based approach to mental illness. This approach focuses on understanding the underlying brain circuits involved in psychiatric disorders and allows for the development of new treatments based on circuit measures. It moves away from the idea of psychiatric illnesses being purely content or chemical imbalances. The conversation then turns to the potential benefits of psychedelics in treating treatment-resistant depression. Dr. Williams discusses the research on MDMA and psilocybin in the treatment of mental health conditions. While the results are promising, he emphasizes the need for further research and understanding of the mechanisms behind these substances' effects. Dr. Williams also touches on the potential role of endogenous DMT in the brain. He mentions a recent study that suggests the presence of intracellular 5-HT2A receptors, which are typically associated with serotonin, but are not accessible to serotonin itself. This finding raises questions about the role of endogenous DMT and its potential effects on brain plasticity. In terms of treatment options, Dr. Williams notes that while psychedelics show promise, they are not the first-line treatment for depression. He suggests starting with more established treatments, such as transcranial magnetic stimulation, before considering psychedelics. He also highlights the importance of managing expectations and addressing the risk of disappointment and hopelessness that can arise if the treatment does not work as expected. Dr. Williams explains that while psilocybin has shown promising results in treating depression, it can be challenging for individuals to prepare themselves for the experience. He emphasizes the importance of psychoeducation and psychological preparation to help individuals navigate the potentially transformative effects of psychedelics. Dr. Williams also discusses the use of ibogaine, a lesser-known psychedelic, in treating addiction. He explains that ibogaine has been historically difficult to study due to its cardiac risks. However, recent research has shown that ibogaine can be a profound addiction interrupter, particularly for individuals with trauma-related addiction. He describes ongoing trials and partnerships aimed at exploring the therapeutic potential of ibogaine. The conversation then delves into the role of glial-derived neurotrophic factor in regulating dopamine neuron health. Dr. Williams explains that GDNF is a broader neurotrophic factor compared to psychedelics and selective serotonin reuptake inhibitors. He discusses the potential of modifying the molecule or using targeted drug delivery to specific brain regions to harness the therapeutic effects of GDNF. Dr. Williams highlights the complexity of mental health conditions and the need for more research and funding in this field. He emphasizes the importance of addressing depression, which is the most disabling condition worldwide. He suggests that by investing in research and exploring innovative treatments, such as non-invasive neural stimulation and psychedelics, significant progress can be made in understanding and treating mental health conditions.